Thank you guys for being here this evening to talk about. I often say to people, I'll go anywhere, anytime to talk about children's mental health because I'm very passionate about that, as I know the rest of our panelists and the Assemblywoman are. If we could do the next slide, that would be great. So I wanted to just talk a little bit about the scope of the problem pre-COVID, because I think we've all sort of heard the news, and I'll talk about the COVID spread in just a minute. But even prior to COVID, we had a very distinct problem with children's mental health in Orange County and across the United States. So 1 in 5 children has a diagnosable mental health disorder during their childhood. And if you think about the scope of that for Orange County, if you guys think about Angel Stadium, I'm sure many of you all have been there, and you fill that up with kids, and then you put 2 more Angel Stadiums full of kids next to that. That's how many children in Orange County have a diagnosable mental health disorder. If you take away 2 of those and you have the 1 stadium left, that's how many kids are actually receiving treatment. So we have an issue and a problem even prior to COVID. We have seen from 2009 to 2018 an increase in mental health hospitalizations amongst children, and that's one of the reasons we built our unit. And we're just a couple of days away from our third birthday. So our unit was actually built even after these numbers. And we have some cities with rates as high as 44 kids out of 10,000, out of every 10,000 are have a mental health hospitalization within a year. We've seen a 32% increase in self-harm visits in the emergency department. And since 2000, you can see that while the teen suicide rate rose 22% nationally, it was more than double of that in Orange County. We thankfully had a much lower rate prior to that, and now we're at the national average, which is obviously not what we want to see. Next slide. And then along came a pandemic and COVID. And what we've seen is, I don't think any of us thought it possible, but an increase in mental health problems across the board with the pandemic. Our mental health inpatient center, also known as MHIC, has seen an increase in admissions, and we've seen both more kids that we've had to admit. Our unit's been pretty well full since the pandemic started. But we've also seen kids stay longer because their mental health problems are more acute. That means that they're more serious, they're more sort of top of line treatment. We've seen some months we have an over 100% increase in the number of requests we get for outpatient therapy, people worrying about their kids. And our emergency department has been inundated with kids with mental health disorders. And I'm sure when I say why, I'm sure this picture may illustrate what it feels like some days in homes while you're trying to manage kids and job and, oh my gosh, all the things going on. But we also know that we as human beings do not do well with uncertainty. So that idea of what does that future look like? And really, when we talk to our teenagers, that's one of the key things they say is, I don't know what's going to happen. And when you think about teens, you know, they seem like little adults some days and are very mature at times, but they also, their brain isn't fully developed enough to really understand future, right? And so what's happening right now can often feel like that's my life forever. And so that sense of teens going, I can't even think about what the future is going to look like. Like I'm always going to be stuck in my house, never going back to school. And that can lead to a lot of those problems. We also know that economic downturns also lead to an increase in children's mental health disorders. For every 5% downturn in joblessness, we actually see like a 20% increase in children's mental health problems. So you can see we have kind of a perfect storm, right? Now, I'll give you one piece of good news, because heaven knows we could all use some good news, right? And Assemblywoman Davies did refer to people going back to school, so we're super excited about that. But then also, even as families and kids note the problems and the mental health problems with the pandemic, a survey just came out that was a national survey that also found about 60% of families said the silver lining for them was they did feel closer, and that there was sort of some sense of growth out of the pandemic and all the anxiety and problems that occurred with the pandemic. So we'll hold on to a little piece of good news there. Next slide, please. Now, not so good news is one of the things we know about, and I think it's easy to sort of think like, okay, great. Once we get kids back into school, we get everyone vaccinated, and we can get out again. We'll be done, right? We'll not be worried about this. Unfortunately, what the literature tells us is for disasters, they can have very long-lasting mental health effects. So long after we've sort of cleaned up all the physical things, for children, those mental health effects can last 3 to 5 years. So I think we all want to come together to figure out how do we best help children? How do we prevent these long-term problems from happening? And how do we really help our kids kind of pick themselves up and go forward in to reach as much of their full potential as possible? Next slide, please. So I'm going to talk just for a minute about some of the higher intensity pieces. I know people had some questions like, when should I worry? How do I know what's a problem with my child? So I'm going to talk a little bit about those. Dr. Bellhumer is going to talk about that second tier, that targeted skill building of sort of how do we prevent and how do we sort of start down that pathway to outpatient therapy and some other types of treatment. And then our colleagues from the San Juan, from the school district, are going to talk a little bit about what are things schools can do to help support children to instill coping skills and do some of the skill building. So you can see that whole continuum of care. But what I do get asked a lot of times for families is like, I don't understand how the mental health system works. Like, what's the right level of care? How do I know where my child belongs? So I wanted to explore a couple of those things so that you better understand what level of care may exist for your child and how I can sort of access that. Next slide. So I'd like to think of this as sort of our continuum of care. And if you think about looking to the left, that's sort of our most severe kind of a child who is at risk of harming themselves. So that's the emergency department, all the way to outpatient therapy. And I'm ending this as an intervention. And then there's beyond that tree, there would be prevention, early intervention, coping skills, those kinds of things. And Dr. Bellhumer is going to talk a little bit more about that. So when we think about it, I think sometimes people sort of are like, oh my gosh, my child's having a problem. Maybe I should go to the emergency department, and maybe they'll hospitalize them, and maybe that will make everything better. So let me explain. The emergency department is really there for kids who are at risk of harming themselves. So if your child's talking about suicide, talking about hurting other people, the ED is absolutely the place that we can evaluate and figure out what's the right level of treatment. A mental health inpatient center, we really think about that as the ICU of mental health care. It's there to stabilize kids, get them past that sort of life-threatening crisis, and then move them into a lower level of care. It's not going to fix the problem, and not every child needs to be on an inpatient unit. So sometimes you might take a child to the emergency department and we might go, we actually could provide some supports in the home, and that would be in-home crisis. We can provide some outpatient therapy and they should do okay. That's actually good news. And I know sometimes it's scary to be like, I took my kid into the ED, or I'm really worried about my kid. Don't they need to be in the hospital? But we always want to treat a kid in the least restrictive environment, right? We want to treat kids, keep them at home with their parents, if at all possible. So we look at all these other types of things, this intensive outpatient program, partial hospitalization. That's where kids stay at home, but we do a lot more intensive treatment. Or we can also look at outpatient therapy, where we might see a kid once or twice weekly just for an hour, and we can maintain kids at that level of care. Next slide, please. I also get questions a lot from parents about, well, when do I worry? Because, I think the sort of underlying thing about being a parent is like worry, right? About my kids, are they okay? How do I take care of them? And mental health is one of those things that's like, who taught me, who teaches us to know when to worry? So I like to look at a couple of things. One is the problem persistent? So does it occur more often than not for a longer period of time? And when we say longer period of time, we think about a 2-week period that more often than not, kids are exhibiting depression, anxiety, social isolation, not sort of like, hey, you know, they came home from being with their friends, they went to their room, they slammed the door, but the next day they come out and they're okay. And then it happens again a week later. We don't necessarily think of that as persistent. Also, is it pervasive? And I know right now it's hard to be like, is it occurring in more than one area? Because pretty much the home is the one area. But as they move out of the home back into school, to church, to other kinds of activities, sporting activities maybe, is that same problem occurring across a couple of different places, then we also would worry more. And then we also look for kids for changes in normal behavior. And that's true for teens as well, especially things like sleeping, eating. So are they sleeping more, waking up in the middle of the night? It's a little hard to tell sometimes because teens tend to go to bed late. That's kind of how their circadian rhythm works. But are you seeing a difference? Are they eating more, eating less? Have they stopped relating with friends, not engaging in self-care activities? And is it causing some problems in their daily living? And if you can answer yes to these questions, then that would be something that I'd want to go and ask my pediatrician about, or access a mental health provider. And Dr. Bellhumer is going to talk to you a little bit about some great resources to help with that in South Orange County. So super excited about that. Next slide. So in this slide, these are just some numbers you can call. The 1-855-OC-LINKS is a number that is more and more having all the different resources sort of with it. And so that's a great number to call. You also can, these are numbers to call if your child's at risk and maybe saying that I'm worried about harming myself. You can call the OC Links line, 911, or some of these other numbers. And then last slide, please. And thank you, Chloe, for putting that in the chat. And then CHOC actually has some specific resources on its website, and Dr. Bellhumer is going to talk about some additional ones. But on our website, we do have access to the blogs. We wrote about 27 different blogs about how to manage during this COVID crisis. Our mental health toolkit has a number of different handouts for parents, for teachers, for pediatricians. Our coping strategies videos has videos actually of our psychologists demonstrating deep breathing, meditation, guided imagery, things that we know help calm stress down and help kids with that kind of stress. And then we also have some tips on how to manage anxiety and how to manage depression. And I see a question right now of, can we share that? I would be more than happy to share the presentation. And I'm sure Chloe can work her magic and figure out how to get everyone access to that for those tips. So I will stop here. I know we'll have a chance for some questions in a bit, but I'm going to hand it over to Dr. Bellhumer, and she's going to talk a little bit more about some of those other levels of intervention.